Good night. I'm going to talk about the heart and circulation number one. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe case it may be present even at rest. A patient who is breathless when lying flat, for example in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOE, it stands for short of breath on exercise, or on exertion, or on effort. Patient says, I get terrible short of breath climbing the stairs. Doctor can ask, how many pillows do you sleep on? Her breathing. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. The heart rhythm may be regular or irregular. In irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitation. Case 4. A 22 years old student was admitted to hospital with a long story of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthoponia, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this has stabilized the symptoms of heart failure, but was followed by episodes of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure include peripheral oedema or swelling, beginning in the feet and ankle. This is known as pitting oedema of when a finger is pushed into the swelling. It causes a small depression or pit. Aorta, pulmonary artery, pulmonary veins, mitral valve, septum, and tricuspid valve. Thank you. Now I'm going to read the exercise. Complete the conversation. Doctor, what seems to be the problem? Patient, I've been getting breathless. Doctor, how long have you had them? Patient, for about 6 months, but I had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't talk more than 100 meters, walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a valve mitral replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. At risk, cardiac output, heart failure, atrial fibrillation, pitting oedema, premature beats, and on effort. Write the words a patient will use to describe the symptoms below. Dyspnea, I get short of breath. Arrhythmia. My heart sometimes beats irregularly. Orthopnea. I have to sleep propped up on pillows to breathe properly. Oedema. My ankles swell up by the end of the day. Complete the case report. Case 13. A 60-year-old woman attended her GP surgery complaining of breathlessness on exertion. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had several episodes of fast, irregular, which lasted 20 to 30 minutes, and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight. Thank you. Ahora voy a leer los ejercicios en español. Completa la conversación basado en el caso historial de la número B. El doctor. ¿Cuál parece ser el problema? Paciente, estoy quedándome sin aliento. El doctor, ¿cuánto tiempo lleva con esto? Paciente, unos 6 meses, pero llevo años con problemas cardíacos, con cansancio y falta de aire. Al final no podía caminar más de 100 metros sin tener que parar y tenía que dormir sobre 3 almohadas. Me reemplazaron la válvula hace 3 años y eso mejoró las cosas por un tiempo. Haz combinaciones utilizando las palabras de cada caja. En reposo, gasto cardíaco, insuficiencia cardíaca, fibrilación auricular, edema con fuvea, latidos prematuros y con esfuerzo. Escribe en palabras de los pacientes cómo describirías tus síntomas. Disnea, me falta el aire. Arritmia, a veces mi corazón late de forma irregular. Ortopnea, tengo que dormir recostado sobre almohadas para respirar. Edema, se me hinchan los tobillos al final del día. Completa el caso. Caso número 13. Una mujer de 60 años acudió a su médico de cabecera quejándose de disnea al hacer ejercicio. Esta dificultad había ido en aumento durante los 8 meses anteriores, hasta llegar a causar problemas al caminar unos 500 metros en terreno llano. No tenía antecedentes de dolor torácico. Había presentado varios episodios de latidos rápidos irregulares que duraron entre 20 y 30 minutos y se asociaron con cierta dificultad para respirar. Al final del día, notó hinchazón en los tobillos y este hinchazón desapareció de la noche a la mañana. Es todo, gracias.